Welcome to a program featuring interviews of state and federal candidates, as well as the incumbents from districts served by Clatsop, Marion, Polk, Tillamook, and Yamhill counties. I'm Ruth McEwen, an advisory council member serving Northwest Senior and Disability Services Advisory Council. I want to welcome candidates, incumbents, and advisory council members to the 2022 Candidate Forum, which is sponsored by our Senior Advisory Council and our Disability Services Advisory Council. Northwest Senior and Disability Service is a local governmental organization that provides Medicaid, Oregon Project Independence, Older Americans Act, and grants-funded programs. The mission of the Northwest Senior and Disability Services is to promote dignity, independence, and health, honor choice, and empower people. The assistance and support we provide consumers include information and assistance, in-home and community-based services, and financial and medical help, meal sites and home-delivered meals, option counseling, adult protective services, Medicare counseling, peer mentoring, money management, as well as health and wellness programs. Because of the number of state legislative districts that our service area covers, we have invited a large number of candidates to be interviewed. Each candidate has been given information on the format used in these interviews. Each candidate will be introduced by a member of the advisory councils. Then each candidate will have the opportunity to answer questions which will be timed. That way you, the viewer, can compare apples to apples. We thank these candidates for their willingness to share their views about services for Oregon seniors and people with disabilities.
Hello, I'm Judy Richards, and I'd like to welcome Ben Watts, Democrat candidate for running for House District 15.
Hi, Judy. Thank you for having me this afternoon.
Thank you, Ben. And we're so glad to have you here today. I'm going to ask you a series of questions if you have time today.
Yes, please. I'm looking forward to it.
Thank you. The first question is, tell us your platform and experience that would encourage a senior or a person with disabilities to vote for you.
Quick introduction. My name is Ben Watts, and I'm running for the Oregon State House of Representatives here in District 15, which is Albany, Millersburg, and Tangent area. I am a husband, a father, and a veteran, and I have two kids that are going to public schools here, just like I did. And since I was born and raised here in Albany, and now my kids are going to school here in Albany, it's pretty cool seeing them go to some of the same schools that I did. Everything's still kind of the same, except a little smaller than I remember it. But I was born and raised here in Albany, and I joined the United States Army in 2001. And I spent 5 years in there where I met my wife. And I also spent 2 years learning Arabic and 1 year in Iraq during that time. And so I do have a service-connected disability rating due to my time when I was deployed. And so I do have some familiarity with some of the issues that people with disabilities experience, especially when they're trying to receive care. And I know that that sort of disability rating really gives a lot of good access to care that I think that we need to make sure that folks are able to have. And so in my own experience, I know that I've gotten access to good care through the Veterans Administration and even some of the local service providers through the VA. But I know not everybody has VA care that they have access to. And so I'd like to see these types of disability ratings be available more commonly to people so they can just get more ease of access to the care that they have. Also, since I've been back here in Albany, since my wife and I decided to move back here and raise our family here, I did work for 10 years for Samaritan Health Services, which is the hospital system here in the Mid-Willamette Valley, in their IT department as one of the managers there. And I do have some good experience with corporate budgeting process. And so I know that it's probably economies of scale when we talk about a corporate budget versus a state budget. I'm sure the state is much larger and many more programs. However, I do think there's probably some similarities that we could probably have some benefits from the experience that I have, and also having the ability to look at things kind of from a corporate way, that how they evaluate funding and funding processes, and also the types of things that we budget, and having that kind of view as well.
Thank you, Ben. Tell us what you know about OPI and how it improves the lives of seniors and people with disabilities.
The Oregon Project Independence Program is amazing, and it's available for seniors and people living with disabilities in our communities right now, especially if they're not quite qualified for Medicaid help. What it can do is for people who aren't needing maybe profound in-home services, but just need a little bit of help to get by and really thrive in their chosen home, to be able to have somebody come in for 20 hours a month and go pick up some groceries or pick up some medication, do a few chores around the house, or prepare a meal. And so what it allows seniors and people living with disabilities to do here in the state is when they just need that little bit of help to really thrive in their home, instead of having to look at something like moving into some sort of other in-home care program, or having to move entirely to a facility. It allows them to stay at their chosen home and to have that care that they need, so they can live in an environment that's healthy, cleanly, and dignified.
Thank you. How would you prioritize state funding, including funding that is matched with federal funds, such as Medicaid, for services to an increasing senior and people with disabilities population?
Medicaid is a great example for the challenges that we're facing in this area right now. So I'll focus on that. And I think it's important to describe the challenge that we're having, and then kind of go into how we should try to tackle that at the state level. And so with funding like for Medicaid, it's a matching system. And so the money that we put in at the state is also matched by the federal government. And the challenge that we have with that is, in the workplace, we're seeing a lot of people who are getting to the point where they're thinking about retiring or have retired recently, and they're becoming eligible for a lot of these senior services that we have available, like Medicaid, and also people with disabilities who are having access to Medicaid programs as well. And so we kind of expect to see that, but what we're seeing on the other end is people entering the workforce aren't entering in the same numbers as the people who are exiting. And so what we expect to see in the future is that the funding that we see for these programs may be constrained by what's going on in the marketplace. Meanwhile, there's a greater number of people who are eligible for the programs that are available to them as seniors and people living with disabilities. And so looking forward and knowing that we expect to see that in the future, the state level, I think how we approach that is we need to come together and say collectively, just to start with, as a base of how we approach it, is that we are committed to maintaining the level of services and the commitments that we have made to seniors and people living with disabilities in our communities. And so that may mean that in the future, we may see a greater percentage of the state revenue go towards these programs. And that will lead to some hard conversations that we probably should have anyway over all of the programs that we have in the state. But we need to make sure that we do keep those commitments to seniors and people living with disabilities in our communities. And also, excuse me, sorry. Also, I think that from a Medicaid standpoint, it's a great program that we need to keep funding. And because we get those matching funds, we're getting a 2-to-1 benefit for maintaining that level of funding.
During this time of increased risk of homelessness and food insecurities, what will you do on a state level so that seniors and people with disabilities no longer face a lack of accessible, affordable housing and receive appropriate nutrition?
That's a multi-part question, and actually responding to them will take multiple parts as well. So bear with me for a moment. I want to tackle homelessness to start with, and we'll move to nutrition. So the threat of homelessness, especially for people who are seniors or people living with disabilities who may be more likely to be on a fixed income, is greater because over the last few years, we've seen the cost of housing just skyrocket. And so if you're on a fixed income, that's going to be a real damage to your finances and may offer some real big challenges about whether you can even keep the housing that you have. And so part of that is that we need to tackle just the amount of housing that's available in the state to try to bring those housing costs down. And so that means that we need to focus on working with the builders in the state to build more low-income housing, like apartment buildings, duplexes and fourplexes. We have to work with them to potentially, especially helpful for people with disabilities and seniors, look at multi-generational homes, which we don't often see in the state. And yes, even build new single-family homes so that at every economic level, we can try to bring those costs down to something that's more achievable. So people are better able to make their rent, or for people that are saving up to achieve that American dream of home ownership, to make that a little bit more accessible for them. Also, on the other side of that, we have programs that are available within the state. Here in the Lynn-Benton area, we have the Community Services Consortium here. If you're elsewhere in the state, you probably have something that's called a Community Action Agency. And what they are able to do is work especially with seniors and people living with disabilities, to help fund housing. If you're going to miss a payment or two, if you can get in touch with these organizations, they can often come in and give you the help that you need financially to make that payment, or if you're just missing it a little bit, to help make that payment, and so that you can stay in your chosen housing and not move into a homeless community. So part of that is simply advertising to targeted communities about what is available for them, and also providing navigators who they can contact, like at the Community Services Consortium here, to be a single point of contact to guide them to the services that are available. And so I think that we could do some targeted advertising to seniors and people living with disabilities to help get them in touch with these resources that are already available for them. And that also feeds into the nutrition program. So tied in with the Community Services Consortium, we also have the Lynn-Benton Food Share here. There's many other food shares around the state, and there's also organizations that will work with the Meals on Wheels programs. And so if we can get that type of targeted advertising and navigators available for seniors and people living with disabilities in our communities, so they can get in touch with the programs that are there specifically to help with these issues, especially with nutrition and housing, then we can get them the nutrition that they need, and not just food, but food that's healthy and meets their nutritional needs. And even in some cases, we've seen that they're able to get nutritionists who can come on board and write prescriptions that'll help pay for the type of nutrition that people in our communities need.
Well, we have one more question. What would you do as a legislature to address the behavioral health issues that have been brought on by health issues and isolation related to the pandemic?
I'm going to couch this with some personal experience. So I have children who are attending public schools, I said earlier, and I had the opportunity to be a stay-at-home dad with them during that time, and I got to see how they started interacting with their friends online only during the pandemic era, and now even in the post-pandemic era, and interacted with school online only. And so all of the in-person interactions that they had kind of ceased. And so it just remained with me, with my wife, with since they're brother and sister, with each other, and then with very close family. And that was it. They didn't really get to see their friends at all. And so, and that's a generation that grew up with electronics. I got into electronics as I got older, but when I was a kid, our phones had a dial this way on them. And so So I didn't grow up with that, but they did. And so people from my generation or even generations before that will not have as easy access moving social interactions to online. And so if you were used to your social interactions being like an exercise class that you had on Sunday morning, like my grandmother had, or with like community groups that you worked with on a regular basis, you got to work with the people that you know in that way and interact. All of that kind of closed up for you. And that can lead to a lot of mental health distress. And so if you suffer from things like depression, often that type of interaction can help you bring you out of your shell. And not having that available can have caused and exacerbated mental health care problems. And so when we talk about mental health care, we really have to talk about the mental health care availability problem in general. And so we are just not seeing the number of mental health care providers that we need in the state. And we need to start tackling that as a whole. And so that means talking with our mental health care professionals about the barriers to entry. We need to go into the schools and talk with students about why they do not choose to enter this profession, or some that do enter it that don't complete the program, why they're not. And for people who do complete the program but end up choosing not to join the mental health care field, we need to find out what all of those barriers are and come up with ways to solve them so that a few years from now, unfortunately won't be tomorrow, this part of it, a few years from now, we will have the type of mental health care providers and the amount of mental health care providers that we need to provide the amount of care that we need in a reasonable time frame. But where does that leave us now, right? And so I go back again to talk about some of the programs that we do have available. And mental health care is a big demand that we see, especially for people who are seniors and people who are living with disabilities as they reach out to social organizations and organizations of the state. And again, we have programs here in the Mid-Willamette Valley, like through our community action agencies and community services consortiums. If you can get in touch with them, they can help get you in touch with mental health care providers in the area that may have availability to get you in or may be able to schedule you in a reasonable time frame. And so that's something that can happen now, but it doesn't address the greater issue of just the availability of mental health care providers that we need to grow within the state.
Thank you. Thank you very much. Today, we have been visiting with Ben Watts, Democrat in District 15. Thank you for joining us today for this interview and with Ben Watts from the area. And we hope that you enjoyed our interview today. And thank you once again.
Thank you so much for allowing me to come on and just chat with you about these programs. I know that one of the big barriers that we have for them is just awareness of them. And so anything that I could have done today to help just get the message out there, I really appreciate the opportunity.
Thank you again.
I want to thank the candidates on behalf of the members of the Senior Advisory Council and the Disability Services Advisory Council of Northwest Senior and Disability Services for attending our candidate interviews. Copies of the interviews can be checked out from Northwest Senior and Disability Services by calling 503-304-3451. Again, that number is 503-304-3451. We hope the information that has been provided will help you make informed choices when you vote. The opinions expressed here are not endorsed by Northwest Senior and Disability Services. For more information or to get connected to services provided by Northwest Senior and Disability Services, please call 1-866-206-4799. Again, that number is 1-866-206-4799. 206-4799. The Advisory Councils for Northwest Senior and Disability Services would like to thank Capital Community Media for the production of the forum. Thank you for watching.